Okay, let's break down a critical skill, how to assess an unconscious patient.
So, you get the call. 50-year-old man, unconscious in a park. The clock is ticking. What do you do? First things first, always. Airway, breathing, circulation. You have to secure the basics before anything else.
For our guy, his breathing was noisy. A quick jaw thrust maneuver fixed it. A for airway, done.
Okay, now we act. It's time for some immediate interventions, often called the coma cocktail.
We start with thiamine. This is key for malnourished or alcoholic patients, but the order is crucial.
And here's a huge board exam tip. Thiamine always comes before glucose in these cases. Get it wrong? Big trouble.
Each part of this cocktail is a diagnostic test. A response to naloxone, for example, screams opioid overdose. If you suspect they ingested something toxic, you might consider gastric lavage, but only after securing that airway.
Now let's check his GCS score. He's at a 7. That's not good. It points to severe brain injury.
But this is the finding that changes everything. Unequal pupils. One is blown. That's a huge red flag.
While you're working, you're also playing detective. What's the story here? You need answers to these questions fast.
A big question you gotta ask, is this a brain problem or a psychiatric one? The signs are pretty different.
When someone's in a coma, you have a mental checklist, and there are 10 things you cannot afford to miss.
These are the killers, the things you have to rule out or manage right now, no exceptions.
So how do we organize all this? We can sort the possibilities by how fast they'll kill the patient.
All right, let's talk pitfalls. First up, glucose. If this is a stroke, giving glucose can actually make it worse.
And with naloxone, the reversal can be dramatic. 1 second they're out, the next, they might be fighting you.
Flumazenil is another tricky one. Use it when other drugs are on board and you could trigger a seizure.
So back to our patient's pupils. That asymmetry, it suggests brainstem herniation. This is now a neurosurgical emergency.